Right now in 2023, access to healthcare in regional Australia could be better. Did you know that 38% of our population in Queensland live in rural or remote areas? This means that more than a third of Queenslanders are having to travel an hour or more to attend medical appointments. And if you have an accident, it's just a roll of the dice as to whether you'll receive timely first aid. Because it is so hard to see a doctor when they have a medical issue, people are leaving treatable conditions to worsen, resulting in potentially preventable hospitalisations, which are costing your government heaps. And the more remote you live, the greater this problem becomes. With poor service availability, a higher cost of access and delivery, and a deficiency in the social determinants of health, we find ourselves in a Bermuda Triangle of poor health outcomes. Almost 80% of Australia's exports come from rural resource industries, so we need to take care of our primary producers. You, dear government, hold the key for unlocking the solution to this issue. But don't just take my word for it. Let's hear from the people who are being affected.
Hey, so my daughter Abby is a type 1 diabetic. She is 17, but probably a year ago she got an infection in her stomach from a site from her insulin pump. We presented to the Kingaroy emergency. She had quite a bad infection that had turned into cellulitis. She needed to be admitted to hospital, but because of the lack of nurses and staff that are trained in paediatrics, Abby was not able to be admitted. She had to stay in emergency to have her care. She was also wasn't able to be transferred because there was no paediatric care available to send her to the Toowoomba hospital. There was no room for her, so we had to wait for a room for a bigger hospital. But with the care we got at the Kingaroy hospital with her IV antibiotics, the infection settled down enough we were able to go home, but that entire time for about 4 days we had to stay in emergency.
Thank you.
I guess I broke my foot, or I was believed to have broken my foot sometime early in the morning. I went to emergency because it hurt quite a bit. Took about 4 hours to be seen. In that 4 hours I got x-rayed, but when I spoke to the doctor at the emergency department at Kingaroy Hospital, he basically said he couldn't read the x-rays and wanted to wait for the orthopaedic team to read it. I got sent home with a moon boot and a set of crutches and no other instructions as to how long that would be for or what it was for. I then got a call saying I'd been referred to a fracture clinic in Toowoomba, which is a 2.5 hour drive on a good day, and that I had to get that followed up. It was 11 days before I managed to get an appointment for that follow-up as well, which was, I guess, a lot of worrying, a lot of waiting, and a lot of pain in the meantime. I guess the impact for me was having to take a day off to travel, having to travel in the first place, and then having to wait an extended period of time for what could have been something that needed urgent attention.